So like we've talked about, for many people who work at a computer all day, every day, even if you've got perfect ergonomics, you're still gonna feel some of the effect of that. Most people tend to get really tight in their mid to upper back just from the natural posture of having to reach all day long, and so that can tend to put some strain through this mid back, and what we feel upon exam is usually that we're nice and springy, we move really well through this lower spine, but as we go up higher it really becomes tight and restricted, and the patient tends to feel that too. They feel that it gets a little more sore and that it's just not got that flexibility that it should. So that is where we deliver an adjustment to get better motion through that region of the spine, and that's important to improving posture, because if you're really locked up in that mid-back, it's going to be really hard to sit up straight. You're going to be fighting yourself. So getting better motion through that mid-back not only helps with the symptoms in the area, but also helps us in that progression of improving the posture. So to adjust that area, I'm going to have you hang your arms down for me. And there are lots of different ways to treat. We're going to adjust her with a light manual technique, where we're going to find right where we're the most restricted. And I'm going to have her give me a breath in and then all the way out, and it's just going to be a light push, and that's it. Nice and easy movement. If someone doesn't do well with, that's called a manual adjustment. There's lots of other techniques we can use. But for her, we're going to actually have her get turned over and do all the rest of our work laying on her back. So one thing that makes our office unique is that the doctors all do a lot of muscle work in conjunction with the adjustments. So through these traps, so right now I'm working on these muscles across the top of her shoulders, is where a lot of people get trigger points and tension, and so we work on those to just get some release of that muscle tension. Typically we spend a few minutes there, and then we move on up to right under the base of the skull. This is always one of my favorites to get worked on, right up under here. So just kind of cradling that suboccipital space, which is where a lot of those tension headaches arise from. Often is kind of a hurt so good for patients. It feels really good to get some work on that area. So we always hold those muscles until we feel it start to let go. And then that's when we know we're ready to move into the adjustment. So through the neck, again with that forward carriage of the head and the change of the curve, we tend to feel that the upper neck especially gets really tight and limited for movement. What the patient might notice is that it's become really difficult for them to back down the driveway. They don't have that rotational movement like they should, so they found themselves kind of adapting and turning their whole body. So that's something that often improves as we work on the motion through this area. So I'm going to demonstrate a manual adjustment through the neck, but again, this is just one technique of many. So if someone doesn't do well this way or prefers lighter techniques, that's always something that we talk about. We're going to go right through here, and it's really much less force than most people think it's going to be. Just a light movement, a little release. All that noise is just the pressure releasing within the joint. And then we're going to get one more spot. So she's actually pretty tight and probably kind of tender, right up under here. We're going to go right there, and that's it. Just a little movement. Getting adjusted doesn't hurt at all. Muscle work might be a little sore, but the adjustment shouldn't be sore at all. And then we like to sit. Go ahead and sit up for me. You can face this way if you want. And from there, we continue to work on the muscles through the neck and shoulders. So we have a variety of techniques to work on these muscles and the muscles down into the shoulder blade. And we're really big here in the office about homework. So I would be going over how to stretch these muscles, how she can work on some exercises, and posture, 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 because that's what's going to get us that stability where we see improvement that lasts.